There's been a drop in COVID-19 cases and an increase in vaccinations. It's giving state and local governments time to prioritize what needs to reopen, and soon. Aisha Hasni has more.
The CDC says more than 40 million Americans have received their first dose of the COVID-19 vaccine. And while states and cities scramble to get as many vaccinated as possible, supply remains an issue.
A recovery for all of us. What does that mean? That means a recovery from the grassroots up. It means getting every neighborhood represented in the recovery. It means reaching people who need to be protected with the vaccine. Of course, the challenge for us constantly is the lack of vaccine supply.
The White House COVID-19 task force announcing vaccination distribution is up 28% since they've taken office. And their new program will work towards getting even more vaccines into underserved areas.
We will begin directly sending vaccine supply to community health centers, enabling them to vaccinate the people they serve. Community health centers are an important part of our broader strategy to ensure we are reaching everyone with our response. Equity is core to our strategy to put this pandemic behind us. And equity means that we are reaching everyone, particularly those in underserved and rural communities and those who have been hit hardest by this pandemic. But we cannot do this effectively at the federal level without our partners on the state and local level sharing this same commitment to equity. They need to lead this work as they know their communities better than anyone.
And for the first time since November, the number of weekly cases across the U.S. came in below 800,000.